And one of the big, let me just say, the stars of the Pinarayi Vijayan cabinet now joins me, KK Shailaja, who's been health minister through this very turbulent time of the coronavirus, also known as Shailaja teacher. Thank you very much indeed, ma'am, for joining us. Congratulations. Firstly, I just wanted to ask you, I believe your own seat.
Thank you.
Your own seat you've won with a huge margin, the highest, is that right? Or
Okay, in my constituency, I got a thumping majority, more than 60,000 votes, and that is a great victory. And our LDF and our Chief Minister also, he had won a very great victory there also in his constituency. And most of the LDF candidates won more than 25,000 like majority. It was a heart-winning majority, we can say like that. A very good victory for the left front and continuation of the left front government in Kerala. That is a historical thing, you know.
No, that's 60,000
all these
votes.
Times, one after another, the governments are coming.
Yeah, 60,000 votes in and especially state like Kerala. That's a huge number. Congratulations for that. But just tell us, ma'am, you know, how challenging this was, because you were fighting the coronavirus. You remained one of the hotspot states. Even now, I'm just looking at the numbers. You have close to 16 lakh cases overall, 35,000 cases being added every day. And despite that, you managed to come back to power.
Okay.
How do you explain that?
I think the people know how we worked on. Yes, I know that the people can understand that how we worked hard throughout this 1.5 years on coronavirus outbreak, 1 year and 4 months. And Kerala had one of the long drawn pandemic. It started in January 30th of 2020 in Kerala, first in India, we can say so. And we were fighting against that virus. The first part, we flattened the curve totally. When the first curve occurred, we flattened the curve, and the mortality rate is below 0.5%. And the second wave occurred here along with other places of our country and throughout the world. And the first part, we delayed the peak, and we can reduce the mortality, and we can build up the health system and put this virus potential under health system capacity threshold. But the second time, it is just after the assembly elections, and there was some gatherings due to assembly election work. And the second peak occurred all of a sudden, a little bit earlier, we can say so. But we worked hard. We are working hard to tackle that problem also. Actually, we increased the beds in the government hospitals.
Yes. Go ahead.
Go ahead, ma'am. The oxygen
go ahead.
production, and in Kerala, the people are the people are getting beds and oxygen supply, ICU beds, ventilators, etc. But it is really threatening this time. The cases increased higher. But if the cases increased this much, our mortality rate is 0.4%. That doesn't increase this time also, because we are treating the people properly. And also we are keeping the elderly inside the home, and we are providing medicines for non-communicable diseases.
Right, so it's been quite a challenge.
Most of them we can save out of coronavirus.
But can I just ask you, you said that the second
that is
wave...
why people are thinking. And also...
Right, just 1 second, I just want to ask you, you said that the cases were starting to rise because of the election campaigning. Are you saying that the second wave in Kerala was one of the was the elections kind of triggered that?
No, election, I think election triggered that, but we cannot say because of election. But there are some other states, there were no elections there. The behavior of virus is like that. The peak will occur definitely. 1 or 2 or 3 waves may occur throughout the world.
Right.
But due to election campaign and gathering of people, the curve occurred earlier. That is, I'm saying.
Okay. But right now,
the rise or the surge occurred not only because of the election.
Okay, but right now, What are your worries? Because, I mean, I'm assuming that you're going to be coming back as health minister or regardless. What would be the big worry? You're saying that you don't have the kind of problem of oxygen that we are facing here in Delhi and other states. If I'm not mistaken, that's what you're telling me. You're saying that you don't have a problem of beds. But what about vaccines? Because lots of states are running out. Do you have enough vaccines? Or is that a problem?
Yeah, I don't know whether I become health minister or not. Left Democratic Front will decide that. It has to be decided.
Okay, but about
we are,
vaccines?
Working now, and yes, the vaccine, the real threat is about the vaccine, we can say so, the real challenge. Because in Kerala, the serosurveillance study revealed that only 11% of the people in Kerala are infected by the virus. 89% is, we can say, susceptible persons.
Wow.
And if we got proper vaccine, we can save all these peoples in Kerala.
Right.
We can reduce the mortality even below 0.4%.
Right.
But we are not getting proper amount of vaccine. We demanded that for above 60 priority group, we want 50 lakhs vaccine. And the central government decided 45 above priority. And then we want almost 1 crore doses of vaccine. And when they declared, our central government declared above 18 and vaccine should given to each and every citizen,
yes,
we should get more than 1.5 crores or nearly 2 crores of vaccine. But we are getting a little amount of vaccine from the center.
How much are you getting, if I may ask?
And the central government give us permission to purchase.
How much are you?
Yeah, we got already, we have got nearest 65 lakhs we had already got, and we give vaccination to more than 62 lakhs of people, and we have only with us below 4 lakh, 3 lakh and something. That is in our stock, but much. That is for the second dose vaccine. We have to give the second dose. That is not very much. At once we should have to get 1 crore doses of vaccine.
Wow, so that's a huge gap. Big challenges ahead of you, ma'am. But, you know, all the best to you. And we continue to look to Kerala as being one of the states that's really at the front lines of fighting this virus effectively. Thank you so much for joining me, and congratulations.